On behalf of Lahey Innovation Hub and our team, my co-director, Dr. Jalil Afnan, and Program Manager Richard Mickeljohn, we would like to welcome you all to the Lahey Innovation Hub and co-present today's event in partnership with Middlesex Coalition about artificial intelligence and how we can advance healthcare leveraging that. Thank you so much for joining us today. There is no question that AI can do technically impressive things and works in many different contexts, and yet adoption of AI in healthcare has been, or I should say successful adoption of AI in healthcare has been somewhat slow, reasonably so, given the need for performance, safety, security, trust, clinical meaningfulness, and so forth. And that's why we gather today, and so glad to bring all the stakeholders together from academia, industry, nonprofit, government, and so forth, from different domain of expertise to think about how do we create the governance and the framework around the adoption of AI in clinical medicine, and rooted in our core values of we respect as an organization, as a healthcare system. 3 pillars of Lahey Innovation Hub stands on that. First and foremost being enhancing patient care and experience of their care, strengthening the workforce well-being, because if we are not well, we cannot take care of others in the fashion we need to and what they deserve. So that's very important for us as an organization. And third, which is very unique and equally important, is creating socially and environmentally sustainable care delivery system, which is integrated at the core of the innovation and not as an afterthought. So with these principles in mind, and without further delay, I would like to welcome our visionary president, Dr. Susan Moffitt-Bruce, to kick us off and say a few words. Thank you.
Well, good morning, everybody, and thank you all for being here. This is absolutely fantastic to see so many people come together today. And I want to thank Middlesex 3 Coalition for partnering with us. They have been fantastic partners over the last many years, and just very, very appreciative of it. Also want to thank all those that have come not only from Massachusetts, but beyond Massachusetts and even beyond the United States into other countries. So thank you for coming and being here. I truly believe that today is probably just the beginning of a conversation, as there are many conversations to have when it comes to healthcare and innovation. Also want to thank from the Office of Economic Development, our new Undersecretary, Zenobia Muchala, who will be speaking with us today. So thank you so much for being here. It really does speak to the importance of this as we go forward. As Sarju said, innovation in healthcare is absolutely imperative. It is impossible to stay with the status quo as we face so many challenges. We have many, many opportunities, but the complexity and what we have to navigate really could be summarized in 3 areas. The first is being stewards of our resources. I think it's not lost on us that we have only so many resources, and that so with every innovation, we have to be mindful of how the impact is going to be felt by our patients and our communities. Secondly, and we're going to talk about that today, the regulatory and the governance around AI, how we translate the AI, the machine, the science to the patient and patient care is complex. It's incredibly complex. And I would also say that it's probably accelerating at a pace that we haven't been able to keep up with thus far. And so we want to, here at the Lahey Innovation Hub, truly partner with all colleagues so that we can do this safely and well. And then lastly, and as importantly, today as it was yesterday and as it will be tomorrow, patient access. How do patients get the care that they need in the place that they want to be cared for by those that can care for them? And we must prioritize our solutions to improve this and the affordability therein. The past year has been one of a lot of activity here at Lahey. We have, this is the 6-month anniversary since the first Innovation Hub launch. We are so fortunate to have Richard and Sarju and Jalil and Mason as well, who's here in the audience, that have set us up in such a good way. And I do think that we have moved from vision to velocity because we believe that we have to introduce innovation at a time that it is absolutely needed. We do want to recognize the support of Mr. Ruben Gruber. He is not here today, but he is the visionary support behind the Lahey Innovation Hub. His work, his vision, his connections have been paramount and foundational to our work today and tomorrow. And I also want to thank again our partnership with the Middlesex Coalition. We are so grateful for your partnership. So since we met last, which was in June, we have continued to deploy AI-enhanced imaging. We do thousands and thousands of images every year for very complex scenarios. And this helps Dr. Afnan and others to diagnose earlier, more accurately. We continue to advance automated robotic solutions, in particular for our nurses and our caregivers at the bedside. We must keep them well and safe and healthy. And so using these solutions, some of which you've talked about today, previous, are important. And we are continuing to innovate in our virtual training environments. We have the opportunities to use augmented reality, simulation, and AI certainly comes into that. But our primary pillar and our true north is patient care. So this has been an excellent year. It's been a busy year. And I think for Lahey, as part of Beth Israel Lahey Health, we truly are continuing to push the boundaries on this. I would like to announce today that we can't do this alone. So we continue to look for partners. We have partnered with Northeastern University, and we have a strategic AI apprenticeship partnership now between Lahey and Northeastern. And I would argue that this is the way ahead. This is the way that we continue to fuel energy, mindset, and talent in a way that is sustainable to keep up with what we have to keep up with. Governor Healy said at the launch of the Massachusetts AI Hub that our state's competitive advantage is truly that we can bring world-class educators, universities, with those of us that care for the patients every day. And I think that we are truly exemplifying that. And so as we position Lahey as part of Beth Israel Lahey Health to truly be innovators in the innovation space, which is a tough thing to do, I think that we are very much poised for the future. With that, I would like to introduce our very first speaker, who is part of PILH, a physician intensivist down at PIDMC, our sister hospital in Boston, and is also senior research scientist at MIT. Dr. Leo Silly will talk to us about all of the innovation in healthcare and what we need to consider. So with that, Leo, we introduce you.
Thank you so much. Thanks for having me and also our team come to Beth Israel Lahey this morning. I wanted to start off by saying that AI should not be just doing more of the same, because that's exactly what AI is doing right now. More of the same, except faster and perhaps a little better. Because more of the same will not solve the problems. You cannot shoehorn AI into very broken systems, because it's only going to rearrange the furniture of a sinking ship. And it's not only rearranging the furniture of the sinking ship, sometimes it's even poking holes at the ship. So it's truly going to be a race to the bottom unless we create a deliberate and thoughtful roadmap for this revolution. So the title of this talk is Ethics by Design, and I am naming 6 tools that I'm hoping we can bestow to society, because what we need right now is to educate everyone. We cannot rely on government regulation to oversee AI, because the field is not just only moving at an unprecedented speed, it is perpetually changing its form and function. So we have to educate patients, we have to educate clinicians, so that everyone will have a basic understanding of artificial intelligence. A few months ago, I was asked to deliver a talk entitled, "Is AI worth it?" And I thought that that question is probably the wrong question to ask, because if the answer is no, the ship is not going to turn around and go back to the shore. It has sailed so far away. The correct question is, how do we make AI worth its cost? And I wanted to start off this day by reminding people, what is the cost of AI? First is opportunity cost. They say that it's hovering around $1 trillion now that are being invested into AI. And in the beginning, it's a zero-sum game. That $1 trillion are being taken away from addressing poverty, from improving the literacy of society about health and wellness. So let's just remind ourselves, where is this money going to come from? And then I hope that this is not the first time that you're hearing about the environmental cost of AI. I'm not gonna recite the statements here. I really hope that you have heard this before. Every language model is melting away one iceberg at a time. And third is the extractivist nature of AI. The materials that we use to build the data centers, they're coming primarily from the global south. The workforce that we hire to fine-tune models, they're also coming from the global south. They are paid between $1.30 to $2 an hour to do the job. And then we sell back that AI into these very same countries, even though the raw materials and the workforce came from them. And we have started seeing this workforce displacement. And unfortunately, women are going to be displaced more than men by about 20%. And we are just seeing really the tip of the iceberg. There is a threat to eliminate all entry-level white-collar knowledge jobs. And when we do that, you hollow out the middle class, because the middle class depends on those white-collar jobs. And what you're going to see is acceleration of global wealth inequality. And finally, the threat to human faculty and agency. Our group just created this model context protocol where it can do the entire scientific inquiry. It could interface into a database. You could ask it to come up with interesting hypotheses. It will identify the patients for you. It will create your table 1 and all the figures. It will write the paper for you and even peer review it. So what will be our role in this entire role play? So let me go back to the first question, how do we make AI worth its cost? It turns out that the answer is not rocket science, but it's an answer that we don't want to hear, because the answer is fix the world. And I'm not going to go over this short litany of what's wrong with the world, but I wanted to point out that the biggest elephant in the room is that the tech bros are reining in this technology. We could be having a very rich discussion around how to oversee AI, but in another part of Boston, there is perhaps several meetings between venture capitalists and health equity, private equity investors who are having a very different conversation, and their KPIs are very different from ours. People think that AI is going to fail because it will be wrong. That's not going to be the case. It will fail because of the illusion of understanding, because it sounds so eloquent and so elaborate that we think it's always correct. And of course, there's also the algorithmic hubris, algorithmic arrogance. It will never admit, I don't know, because who would want to buy an AI that keeps saying, I don't know? So this paper came out, I believe, in October from Microsoft. And what they did is to figure out if you give AI multimodal input and ask it an answer, where does the answer come from? So what they did here was to use several language models, and they gave it multimodal medical exam questions. And then they started masking some of the parts of the question. In the last row, you could see they masked the picture of a nail that is very important to answer the question correctly. And guess what? AI still answered the questions correctly because it learned it from the architecture. It learned it from the training. And when they asked, well, why is this the answer? It was saying, well, the image shows that, even though there was no image. But that's how it was trained to reply to these questions. What I wanted to highlight is what we have been doing really in the last, I would say, almost a decade now. We think that what is required is a level of collaboration across disciplines and across generations that we have never seen before. We need to bring the patients and the students into the table. They have to be part of the solution. The solutions cannot come from the same people who created the problems, that's us, who have been doubling down on the status quo. We have to embrace humility and the understanding that we will not be able to create a curriculum. We are the last generation who learned without AI, and we are expected to create a curriculum for the next generation who will learn with AI. So around the world, we bring students, from high school students to health ministers to CEO of companies. We tell everyone to leave their hubris at the doorstep because hubris is the enemy of the good. It's not good yet. And we create a safe space for people to question each other, to pull people out of their echo chambers, and that's very difficult to do in healthcare. So we started with the beginning, with the title that we bring 6 tools to the world. A mirror to reflect our motivations. When we say efficiency, who does that benefit? We have to reflect on our value systems. A flashlight to shine on all the systems that we breathe day to day. A microscope, this is where data science comes in. We have to examine the strengths and limitations of the systems that are part of our day-to-day. A paintbrush, which is probably the most important tool because this allows us to reimagine what would education look like if we have a clean slate. And I wanted to invite you, we have an event at MIT coming up next month, January 15th, where we are inviting artists, musicians, storytellers, influencers, indigenous leaders, religious leaders, and we bring them into the room with clinicians, computer scientists, and philosophers. And we will offer 3 workshops on how to reimagine learning in this age of AI. The podium is very powerful. It is giving a space for people to share their stories, their successes, and their failures. And finally, the slingshot, which reminds us of David and Goliath, because our enemy are the power structures that dictate how innovations like AI are going to affect our patients. So I'm going to end off by quoting Bruno Latour. He said that AI should not be seen as a technological phenomenon, but part of a complex assemblage of human and non-human factors that are continuously reshaping social reality. We should stay away from general pronouncements about AI is bad, it will cause brain atrophy. Instead, we have to focus on specific practices, translations, and transactions that AI enables and facilitates. We need to understand how different actors, the programmers, the clinicians, the users, data, algorithms, patients, regulatory bodies, how they negotiate and stabilize new forms of agency and authority. And finally, I introduce our Bodhi project. Bodhi is Sanskrit for awakening, enlightenment. B stands for bridging. O is open, D is discerning, H is humble, and I is inquiring. We are creating multi-agent, multi-human systems that will put each other on the rails. We want to imbibe these systems with human virtues such as curiosity, creativity, and humility, so that we could truly enhance our connectedness as we interact more and more with this fast-moving technology. And it also symbolizes the democratization of AI development, evaluation, monitoring, and oversight. Thank you very much.
Amazing. Thank you, Dr. Sally. Absolutely incredible thoughts as always. I'm sorry that you can't see all the questions. We are gathering questions, so a big part of today's audience poll is we want to hear from you. We want to understand what are your concerns? What are the questions we need to answer when we think about delivering AI in healthcare? We do have quite a compact schedule though, so I'm going to move on to our next panel. Invite Dr. Afnan and panelists to come up to the stage, please. Just quickly, if you're standing, there are seats and please, if you want to grab a seat, please, you're welcome to come down to the floor.
Good morning. It's a pleasure to be here, and it's wonderful to see a packed auditorium. It was a cold and rainy and miserable day. It reminded me of London, so I feel very much at home. But we're here, and it's warm and inviting, and we have lots of opportunity for curiosity and questions. This is the first of the two panel discussions. I'm going to invite my panel members to introduce themselves, although I'll take the liberty of introducing Dr. Moffett-Bruce, who is my president here at Lahey. Susan has been here for a few years and is an incredibly dynamic leader, really bringing forward, I think, the key elements of successful leadership at this point, which is collaboration. Having a vision, but being open to collaboration, which is really what this event is all about. So with that, I'll invite Lee to introduce herself.
Sure. Good morning, everybody, and thank you for inviting me to attend this session today. My name is Lee Rogers. I am the nursing director of informatics at Lahey Hospital Medical Center. Currently, I am helping to co-lead a nursing ambient implementation at our facility. We're going to start out small with 2 pilot units, and then it will scale up across the system. 50% of my time is initiatives at the local level, and the other 50% of my time is spent at system level initiatives. So I have participated in other AI topics and looking at all that. I have about 18 years experience in the informatics realm and looking at all of that, so I'm very excited to be here to converse with everybody and answer questions. So thank you.
Thank you, and Adrian, please.
So thank you for having me as well. Today I'm really excited about the conversation we're about to have here. My name is Adrian Zai. I'm the Chief Research Informatics Officer at UMass Chan Medical School. My role is kind of split into 2 halves. One is administrative, focusing on co-leading the AI Assurance Lab and among many other projects. And the other half is really as an associate professor, research on AI development, implementation within the learning health system framework.
Fantastic. So we are challenged with a rather broad and extensive topic here to invite these healthcare leaders to comment on the impact that AI has had. And this is a challenging topic to engage with in 28 minutes or 27 and a half minutes. We also would like to invite some audience participation and some comment. But we will kick off with a few questions to each of the panelists and then see where this takes us. So I think the first question that I would like to invite you to respond to is, as leaders, if there's a bewildering amount of AI product and tool out there, how do you go about assessing what product to bring in, where the innovation drive ought to be? And that to Susan first, please.
Yeah, so I think that's a really great question, because I think, as I alluded to in my opening remarks, this field that is really here to ultimately improve the systems that we work in and take care of patients in is accelerating at such a pace. I think that's why we have kind of had to step back and organize ourselves. I've been here just under 3 years, and more and more AI and truly augmented support has come to bear, and so we've tried to organize ourselves, which is why the Innovation Hub is important, so that we can have colleagues, technologists, we can have scientists come together and discern in the first instance what is possible. Then we engage our clinicians, make sure the clinicians see that there's value added. And then thirdly, really do a test of change and use really thoughtful process improvement frameworks. If we implement this, first of all, what's the problem we're trying to solve? Secondly, what is our current state? How do we measure success? And then how do we start that over again? Kind of back to the learning health system perspective, that we're always learning from whatever we implement. The majority of what we look at every day is really, at least here at Lahey, is really to say, how can we take care of patients better? How do we take care of patients so that it's more efficient and they get back to their homes and their families? And how do we keep our caregivers, our nurses, our doctors, all of our colleagues better and safer and more well, which is my primary concern. And there are lots of great opportunities, but we need to organize ourselves and apply scientific discipline to it.
Thank you. And same question to Lee. And also, I really want to highlight that in the context of clinical care delivery, it's so vital to think about those that are frontline care providers who are facing the challenges of the volumes, the complexity of the patients day in and day out. And when we think about what that looks like in a hospital environment, that's often our nursing colleagues. And so I just really want to highlight that in particular.
Yeah, happy to answer the same question. So our perspective is similar to what Susan is mentioning. We're starting out by looking at what is the why, and is the why clear? Because if it's not clear and it's fuzzy, then we have to take a step back and understand. And what questions are we trying to address? What problems are we potentially trying to supplement, not necessarily solve? Because we're not going to be able to use AI to solve those problems, right? We need it to be an adjunct type of technology that's available for our staff. There's a significant concern out there, as we just saw in the presentation prior to that, AI is going to replace all of these jobs. And in some industries, that's reality, right? Healthcare, that can't happen. There's a patient at the end of that. At the end of the day, the patient is required. But to take a step back, when we're looking at the technologies and to your points, there is so many vendors coming at us. There's so much coming through the door. And we are really having to take a step back at this point and analyze what is actually coming forward. Who are the best decision makers up front? And then subsequently pulling in the key clinical stakeholders to help address that and get their engagement ahead of the curve. You don't want to go to them and say, here's something we're going to implement. We want you to make it work for you after we've already made that decision. They need to be part of that decision. They're burnt out right now. As we know, healthcare is really difficult. I'm speaking from a nursing perspective. We have 6-7 patients a shift that we're trying to care for. So whatever I'm offering to them or we're offering to them collectively and in partnership with them needs to be supplemental and needs to help develop that.
And same question to Adrian, thank you.
So I think just the word vendor means it is a client typically, right? So I think that dynamic that exists between vendor and client probably will need to be changed in the context of AI, because it is a collaborative work. And I really believe that the We Care mission that I just saw there, right? C stands for collaboration, and the vendor is actually part of that team, right? So I don't think we need to see them as vendors, but as partners. And from the vendor perspective, they really need to see the healthcare system as a collaborator within for the purpose of developing the AI, but more importantly, identifying the problem and the value of what they're trying to solve. So that alignment is key because what I've seen is that the AI model itself is really just one step to solving a problem, right? And oftentimes it's not even the rate limiting step because there are amazing models, AI models that are performing like RC curve like 90, right? But yet provide no value at the clinical front. Right? So I think that dynamic has to be kind of shifted.
You know, I promised that we didn't plan this and I'll pay you later, but the intent of using the vendor concept at the beginning was exactly what you raised. So this takes me to the next question, which I would like you to respond to first, which is how do we engage earlier on in product development? How do we understand that within healthcare, within the hospital environments, we don't have all of the tools at our disposal to solve the bigger question we're dependent on this collaborative approach. So in your experience, have you found that to be successful? Have you got a pathway for that? Is there a way to engage with early stage companies in particular around product development?
Well, I want to say that we didn't plan this question either, but at UMass Chan, we started putting together an AI assurance lab funded by Mass Tech. And one of the purpose of this AI assurance lab is to provide a common evaluation development framework for AI, where the clinical representation is there. The clinical partners are part of the stakeholders, where we invite the vendors to come in and work together to develop these technologies. And also coming up with not just the AI model, but an evaluation framework that is post-deployment as well, right? So post-deployment monitoring, because of drift and all that stuff that happens with AI, is so critical that it should be in our mindset from day one, from step one, right?
Thank you. And I'd like to invite Susan to respond also.
Well, you made me think about something, and then when Leo was speaking about we are a generation that, some of us are of a generation that were not taught with AI. So I think the partnerships that we need, the collaboration, whether or not it's with the technology experts, the scientists, I think it needs to start really early on in our paradigm. I'll give you an example. We get these technologies brought to us. I'm the president. Dr. Rob Fields is helping implement AI across BILH, and we are the ones that have to help discern when and how. We then had a question after we deployed ambient AI, which is allowing you to take notes in the clinic visit without typing on the computer, and all of the attendees, all the faculty are using it. Then the question came, should we allow the medical students and the residents to use it? Well, my first response was, well, they should learn how to do an H&P or history and physical like I did. However, I went to my colleague, Dr. Dean Mosenthal, and she said, Susan, this is how our learners are now learning. They're learning in an era of AI. And so we actually have to back up and have those that are developing these products work with the learners early on in their careers and their trajectory so that we get it right. Because they're going to have a lifetime and a career time of using AI. And those of us that are here at the end of, or at this point in our career, is very different than those that are learning real time. And so I think it's not lost me that we are partners with UMass Chan and that we are a new medical school. So we could get this really right in the beginning. So I just bring that as a different concept to how we can be thoughtful about the implementation of some of these products and innovations.
I am a little challenged with that, I have to say. So my middle of three boys, who's 15 and just started high school, has embedded on his school laptop Grammarly and all these kind of other tools to help him speak, essentially. And it's very different from how I grew up. And I learned English and I learned grammar and I was told off if I got things wrong. And meanwhile, he just communicates in grunts and so on. And the tools at his disposal indicate to him do you mean that? And he's like, yes, I mean that. He just presses the button. But that's actually the reality of the world we're moving in. And it takes, as Susan says, it's an opportunity for reflection around the paradigm of education within healthcare and what constitutes the skill set of a physician. What does that look like? I mean, these are rather large questions to chew on, but in many ways, as we think about what it means to be a provider going forward in the modern world, what are the skills that we need to take forward with us? And what are the elements of AI and technology that we're willing to cede control over? Because actually there's no reason for me to spend time doing a certain thing if in fact the system can do that more effectively, more reliably, more consistently, does not get tired, learns from its mistakes, and so on. Lee, I'm curious, in some of the work that you've been doing around this, how have you been able to engage with the nursing leaders and nursing groups under you to kind of give feedback on product development?
So primarily, it's coming from partnership and just detailed discussions, but really starting at the basics. Do they even know what AI is, right? And do they understand that its ramifications in healthcare? So getting them to understand that as a basis and then looking at it a little bit further and tying it into day-to-day activities. A really benign example would be me teaching them how to use AI to capture notes in a meeting, right? Getting them acclimated to that, the fact that it's listening to their conversation in these meetings and it's generating their minutes for them, looking at all that. So taking baby steps in that direction. And then further exploring and presenting, we have this ambient technology being utilized by hundreds of physicians throughout the system. Look at the time that it's saving, looking at how the formatting of the notes has been improved and how I can generate more revenue because I'm coding more effectively and looking at all that. And then taking that and putting a nursing lens on it and saying, well, how can we implement this in a nursing setting? And how can I get you engaged? But simultaneously emphasizing to them that the success of implementing the technology relies on them being aware of it, understanding it, and backing it up 100%. And being available for the staff all of the time. And leadership engagement is so imperative in the success of this. I would say, primarily speaking from a nursing perspective, if they're not able to articulate, and I'll reflect back on what I said earlier, the why of why we're doing this, then it's going to be lost on the staff. And making them understand and be able to articulate too that I'm not creating more work for you, I'm trying to circumvent a process that does take extra time out of your day. So that's how we're approaching it.
Thank you. So I'm going to start to begin to summarize some of the themes that are coming out of this, which is that the leadership within healthcare is anxious and eager to collaborate and to engage with development of tools that are aligned with the goals for all of us, which are aligned to ultimately for patient care. We have a few minutes to consider governance around this. And that's a few minutes for you to reflect on questions you may like to ask the audience. So in a few minutes, I will pose the open part of the forum to you. But for now, could you share how you are managing the governance of these tools, how you're determining if it indeed has been affected, if any issues have arisen from the use of a tool?
So I think it's one of those opportunities that we really need to manage not only locally but also at the system level. At BILH, we're really taking an approach such that there is an integration of IT, strategy, privacy and compliance, and clinical outcomes. And I think with every opportunity that we have to implement an augmented support through AI, we need to think about what are those. We have to consider all of those aspects of it. And I do think, going back to the governance again though, as long as it's going to augment or improve the way we care for patients, it makes sense and it will go through that process. But to just replace or to repeat what we're already doing will not work. You know, you can imagine a patient right now comes to the hospital, they don't know where they're coming, they gotta find parking, they have to check in at the front desk, they have to go to the registration, they might have to go down to the pre-op center, they have to go, and they do that usually on their own. But could you imagine if the front desk colleague now knows the patient's already coming, they can reach out to them on their phone before they get here and say, just text me when you get here, I can meet you at the front door, and then they have a seamless, you know, so we need to use these tools, and so the governance needs to be strategic, that things that are implemented have to be such that they will improve, not repeat what we're doing currently. And so that's a perspective governance has to have, open-mindedness to the point that Leo made, curiosity, engagement, and empathy.
Adrian, same question to you, and maybe to also touch on elements of AI tools in particular that may potentially have bias, or you know, how do you deal with model drift? Who is responsible for that as you engage and deploy a product within your environment?
That's a good question. I think there are two states where we are today, right, where most of the model evaluation testing happens after development, obviously, right? So you usually have an assessment of model performance. Then after that, there is piloting, right? Tested in a controlled environment with clinicians, and then there's a deployment, right? So oftentimes there is a one-time evaluation at the assessment on performance. That's it. It's a one-time, literally. And then after that, during the pilot, you get some basically general feedback and look at overall performance, and they deploy it, right? Deployment could be, you know, local, multi-sites, right? Not using the data that it was trained on, for example, right? And obviously model drifts and all of that happens subsequently. The governance today probably happens at best, I would say, at the hospital, after it's deployed, at best, right? The challenge is that I think governance should happen throughout the entire development life cycle of an AI model, starting with defining the problem itself that you're trying to solve. If you define the problem, you should define also how we're going to govern that, right? So oftentimes that becomes an afterthought and is pushed way back in the life cycle. So I think the first step is really, as you develop, engineer the model, right? You have to think about explainability, transparency of the model, how would clinician view this model, right? Typically that first stretch of the AI life cycle does not even involve clinicians, right? Or nurses. Whose life actually gets impacted on, whoever's going to be using that should be part of the team that defines the problem at the very beginning.
Thank you. And Lee, governance.
I echo what both my colleagues are saying here, but I also feel that governance needs to extend to the results that are generated from the AI. So for example, if you have a predictive model that identifies early on that you are prone to coming down with pancreatic cancer, which we know has a low probability of survival, right? What do you do with that information? Where are the ethical guidelines around the data that's being created from the AI and looking at all of that too? So those are the types of things that I look at. It does run the entire spectrum, but when you talk to clinicians too out there, they worry about the data outcomes. Like, what am I going to do with that? And then, you know, it was mentioned in conversation earlier today too, that, you know, patients can Google their symptoms, they can come up with a diagnosis. Well, who's supporting them with all of that? Oftentimes with the portals and everything, they're getting their information long before we are, right? And they're self-diagnosing. And then they're, you know, running over here saying this, that, and the next thing, and then they're looking up the things online, and AI's giving them this prediction, you know, and all of these treatments that are not necessarily true nor applicable in their situation. So for me, that I think is an important factor that we also have to consider with governance.
Thank you. I will open it up for questions and you know, just we can continue talking and doing this, certainly. I think as we move forward and think about what governance looks like, clearly there needs to be shared governance. And I think that, we're so happy and thrilled that we have state representatives as well participating in the event, because these are challenges that truly face us all societally. How does one govern something that is totally novel and that is essentially embarking on its own trajectory? How do you define rules and lines around that? It's incredibly difficult. I would also like to make the point that it affects all of us. I mean, as far as I can tell, there are no robotic forms in the audience. I think we're all human. So this is us. We're talking about ourselves, actually, as well as our patients. And much of what we're seeing in healthcare, which we talk about in somewhat gloomy terms in the sense that there's an overwhelming amount of work to do, this is actually a measure of success. The fact that we have an aging population is a marker of success in modern medicine, that people are living through successfully 1 or 2 cancers, are able to prolong their life. So this is in fact sort of a successful maturation of humanity. And then how we integrate the technology to support that really is critical. So again, more than happy to take any questions from the audience. If there are any, yeah, please do. There are microphones.
Thank you. I'm Peter Shea. I'm the Assistant Dean for AI Integration at Middlesex Community College. And I'm very interested in the points you made about the changes in healthcare education that will be needed to prepare students for an AI-infused healthcare work environment. So what advice would you give to us to revise the curriculum and our way of thinking about it?
I'm happy to start. I think the first thing is involve the students, right? What is it and how is it that they want to learn the content that they have to learn? I think secondly, I do think that there's partnerships to be had in industry and with technologists and scientists, because there's so much to learn. And what format can it be delivered such that there's just in time or more longitudinal learning as well? It is such that, when I trained as an intern, we had books in our pockets. I haven't seen a book in an intern's pocket. Well, I haven't seen an intern for a while, but I haven't seen books in residents' pockets for a very long time, right? So I think, involving the students first and foremost. Secondly, kind of defining the problem. What is it that they need to learn to care for those patients when they don't have all the supports? And then understanding who can we partner with to refine the way that we're teaching and how we set those expectations. It's a very complicated equation, but I think it's one that we have to address, or again, we're not going to keep up in the education space with the reality of care for any care provider.
So my reaction to that is, I think learning is bidirectional. So it's not only the student learning, but the teachers learning from what the students are doing, because AI is evolving so quickly. There are so many tools out there that they're using that we are definitely not aware of. It is, I think, critical to learn how they are learning. I recently heard a talk from a medical student, and I am so impressed by the way they use AI to learn and prepare themselves for a surgical case or whatever they are facing is very different than how we used to prepare and learn in the past.
Totally different.
I would say as well, like to the points that are being made here, setting up your faculty for success, offering them opportunities to become competent in some level of AI, whether it's that bi-directional relationship between they and the students, or even structured education for them, exposure to seminars, webinars, etc. That's honestly how I'm teaching people, having them attend these types of things, getting them acclimated, because they need to be able to speak the language that their students are speaking. They need to understand them on their level.
I should add that several of our faculty are here today, so we're following your advice.
Awesome. Thank you. We appreciate it.
Thank you for the question. It's really, I think I've also reflected on what constitutes a doctor. And I think that, when you think about the concept of health and healing, perhaps it's beyond the reaction to disease that we currently assume medicine to be. So perhaps the doctors of the futures will be involved in agriculture, farming methodologies, food production. Where does it sit? What is the meaning of health, and what does a health provider, what does that look like? So these are very broad concepts. Please.
Hi, my name is Thomas, and I'm actually from Philly. Thank you so much for this insight. I love it. My question is around trust in data and AI. As you may know, garbage in, garbage out, and in healthcare there's a spectrum of data. So how do we make sure there's trust among institutions and among between the patients and provider, so that we can all share data in a trustworthy manner? Thank you.
What a great question, and perhaps also touches on federated research models to kind of inform some of the AI development. And like we have 2 minutes, so.
Yeah. I think just practically starting such that, you start with the implementation of tools in a trial and verify manner. For instance, with the use of ambient AI for note production, the physician or the advanced practice provider is responsible for that note. So it's generated, they have to validate it, and then the patient sees it, right? And so, and other providers, so there has to be oversight and over-verification and validation during those trial periods before it gets taken to any different level or to other colleagues. So I think starting small, validating, verifying, and making sure the patients are comfortable with those tools that we're using. It's going to take time, but I think it's worth the effort.
Yeah, I echo what Susan is saying. We're looking at implementing, predictive models and looking at all of that. We run them for months at a time in the background, validating against, manually abstracted information just to confirm that the findings are aligned and correct. And I think that that's what we have to do, is we have to really start small and then scale up based on the findings.
So I see trust as an end result of a whole slew of things that have to happen, right? In order to earn trust, models have to be safe, equitable, fair, right? Secure, the data has to be secure, models have to be transparent, a governance system has to be established, the AI has to be accountable, right? So you need to meet all these different dimensions in order to actually build trust. And local data validation, all these kind of things are basically just a list of a whole checklist of things that have to happen for trust to emerge. And obviously, again, back to collaboration, having the person that's involved in using this AI that needs to trust this AI to be part of the building process, all of it.
Is it permissible for one more? One more question.
Yes,
Please.
Hi, thanks for being here, folks. My name is Roth Griffin. I'm the co-founder of Tech Startup. My question is, I guess it's an observation first and a question. The observation is, from the patient's perspective, AI in healthcare is already happening because they go to ChatGPT, right?
Yep.
So, that's just an uncomfortable truth, right? It's like, that's not within the auspices of a hospital, it's run by this technology. So my question is, from your perspective, what does it look like to move aggressively enough or fast enough to do something that is within your auspices, so that it can be done in a good way, in the right way? What does that look like, given that it's already happening for patients? Thank you.
That's for you.
Good luck.
Good question. I think that my perspective is that we're still learning. We really don't know the answer. We don't. We know our patients are using ChatGPT and other avenues, right, to explore what their current healthcare needs are and status and looking at all of that. But we really don't know the full complement of it. I can honestly say, we like to focus on human-centered care, right? With the patient at the center, or even the staff person at the center. And, but in order for us to fully understand that, I really feel strongly that we have to involve them from the beginning and say, what is it that you're looking for AI to do for you? You know, not, again, to the point that I made earlier, not that here's the AI that we're going to implement on your behalf. Let's see if it works for you. Tell us what you need first, and then we can develop it there. Not a perfect answer, I completely understand, but it's so gray still.
Yeah.
And yeah.
That's a good summary.
Yeah, I think again, you know, it's part of that partnership collaboration, right? The patient is at the center of all of it. All these discussion needs to involve the patient. I think at the forefront, concerns that patient may have are privacy of the data, use of the data, right? So showing security, how do we respect the use of the data? And I think the second aspect that they may be worried about is AI making decisions, or is it my doctor making decisions, right? So I think really explaining and working together with the patient, really showing that the AI is here to enhance the doctor make decision, right? As opposed to replacing a doctor making decision, right? I think these nuances are going to be critical in developing the. In the end, it boils down to the clinician and patient relationship.
Well, I think, you know, we could continue this for quite some time. We will have to wrap up in the interest of time. But thank you so much to my panelists, Adrian, Lee, and Susan.
Could I have another round of applause for our panel? So when we first started planning this event, we, Middlesex and Lahey, we knew our biggest challenge is this time. And any one of our speakers could speak an afternoon on this subject. So this room is filled with a lot of knowledge. So thank you for sharing some of that with us. For those of you who don't know me, I'm Stephanie Cronin. I'm the Executive Director of the Middlesex III Coalition. And for those of you who don't know the Middlesex III Coalition, we are a regional economic development organization. Oh, am I in charge of this? Okay. So the Middlesex III Coalition, we are a regional economic development organization. Our role is to bring the public and private sector together to improve economic development in the region. And we do that by a number of different ways, by building communities, creating partnerships, introducing our private sector to some of the many resources that are out there to help them expand, to help them to grow. We do that by moving forward some of these conversations, whether it's on AI, our workforce, our transportation, our permitting, our housing, our infrastructure. None of them are easy issues, but by coming together, by working together, we move the ball forward, we make this area better for economic development and a better area to improve and to do business in this region. And we also do that through different events, whether it be like this great event today. We also have a manufacturing event later or early next year. We're working with a defense roundtable as well. We have a workforce roundtable of life sciences. There's just a number of different events that we try to pull together to get those conversations going and to build that community that we keep talking about. So right now, we had a great conversation on what's happening with AI. We want to pivot a bit to talk about the future. How do we build that AI-ready care community? And to kickstart this conversation, we're fortunate to have the new Undersecretary of Business Strategy, Zenova Muchala, as our keynote speaker. Undersecretary Muchala oversees the Massachusetts Office of Business Development. And if you don't know MOBD, please connect with me. I'd love to connect with them. They are such a great resource. They really do have a lot of resources in this area as well to help you as well. She also works closely with many of the other quasi-government agencies. Many of them will be speaking afterwards as well. Many of them have been outside as well. So hopefully you can connect with them too. Undersecretary Muchala may be new to the Executive Office of Economic Development, but certainly not new to innovation in Massachusetts. She's the co-founder of Care.com, the former CEO of Sitter Cities, and Group VP of Marketing for Bright Horizons. Please help me to welcome Undersecretary Ujala.
Oh, thank you.
Hi everyone, so that's me. Hi everyone, it is such a privilege to be here, and I want to extend a real thank you to the Lahey team for inviting me to represent the Healy Driscoll administration. So I'm at the Office of Economic Development and the Undersecretary for Business Strategies. I'm very happy to represent Secretary Paley as well. And our goal at the Office of Economic Development really is to drive growth and create job opportunities across every sector, but with a real focus in the innovation economy and to maintain the leadership position of Massachusetts when it comes to sectors like healthcare, life sciences, deep tech. And it's a real privilege to be able to do that. And a lot of our work happens through MassTech Collaborative, which is a quasi-agency. And MassTech Collaborative has taken the leading role in forming the AI Hub. So in late last year, Governor Healy announced an investment and created the Massachusetts Strategic AI Task Force. One of the key things that came out of this was funding for the AI Hub, with really the goal to responsibly create programs for AI. Sabrina Mansour joined as the director shortly after and has put in place some really excellent programs, one of which we are here to celebrate today. But again, I think, as it was mentioned, I'm only 4 weeks into the job, but I really do feel like this is a culmination of a long career that's been spent very much in the innovation economy as an entrepreneur, as a startup person, and really focused on the pure belief that tech, especially now with AI, can create excellent platforms and tools to benefit families, to benefit all of us, to benefit everyone who lives in the state of Massachusetts. And that's what really brought me into this job. My career in this field in really education and care started in 2002. I was at a company called You Promise that really believed it was a mission. We called ourselves a mission-driven for-profit. And we believe that the day to start saving for college was the day your child was born, and use technology to build an amazing platform where leading companies in America could give money back that could be put into your child's 529 account. And I was there for 4 years. It was an incredible experience. The entire founding team of Care.com actually came out of You Promise. We had all worked together as product managers. And I spent the next 11 years with this excellent team building out a platform that helped families solve what is one of the other biggest problems that they face, which is how do we find care for the people that we love the most, whether it's our children, our parents, ourselves, our home. And we were able to create a marketplace that scaled to be 10 million families and 10 million caregivers, and we were facilitating matching these two sides of the marketplace so that people could receive the care that they deserve. And most recently, I was at Bright Horizons as CEO of one of their subsidiaries and also running the marketing team very much to scale the utilization of benefits such as childcare, education for employees so that they could continue to flourish and their careers continue to thrive. And so I really believe that tech is a force for good. Every company I've worked for since You Promise, as I said, we call ourselves a mission-driven for-profit. But I also put myself in the category of a techno-optimist Luddite. So I put a little moment on that Luddite bit because it means I'm personally quite a slow adopter of a lot of great tech. I greatly encourage you not to look at my Instagram and Facebook pages because you will find nothing, and strongly believe that tweeting should be exclusively reserved for birds. But
the Lahey part is also a bit of a value-driven moment because it is about how do we thoughtfully and responsibly use technology to really further our ability to provide good to people. And I think that's really what today is about to a large extent. And it spans everything. It's the conversation I've had with my 14-year-old about how is it okay to use ChatGPT to do schoolwork, and the answer can be yes, it's great if for his entrepreneurship class where he's writing a business case, but not so great for the essays that he has to submit in his English class. And I'm really relieved to say my 10-year-old mainly wants to just use screen time for Pokemon. But we are getting to those conversations. And I think it's that value of thoughtfulness and the approach that the Massachusetts government has to AI. And it really is embodied in the AI Hub. Right, I think the AI Hub's mission is committed to making the benefits of AI accessible to all businesses, researchers, and residents alike in a responsible way. And I had a real privilege almost a month before I started this job to be at the AI Hub's AI Challenge, where awards were given out to universities. There were 7 awards that were granted. To develop AI models to solve a problem that Massachusetts residents are facing. And yesterday I got to visit ARII, which is the Atlantic Research Innovation Institute. And actually they were one of the awardees of this of the AI Challenge, and actually got to see what they were doing in action. And it was just an amazing example of climate resiliency. They are greatly expanding the number of sensors that we have along the Massachusetts coastline. I was floored to learn we started out with just, I think it was 1 or 2. But the goal is really to have sensors across the entire coastline and extending into New Hampshire, Maine, and Rhode Island as well. It's also a job creation program because now with the sensors, there's so much more data. There's so much more support that's required for what is a fairly technical job of placing and monitoring these sensors. And the data has been used as a public commodity. You can go and see what's the temperature of the water if I want to go swimming, if you're a little nuts in this weather. But we know that happens. It's very much used by boaters as well. So this is just an amazing example of how the AI Hub really is at the forefront of job creation, climate resiliency, and now health. And it's just one of the programs that they are doing. Another commitment of the Healy Driscoll administration is in the $31 million that went to develop the Artificial Intelligence Compute Resource, or ACRE. I'm new to government, and I can tell you, man, we love our acronyms. You know how you get a new job, you start dreaming about it at night. My dream has made me a nightmare that I have to go in and take the exam and tell you what all these acronyms mean, like ACRE and SHIELD and DRIVE, and it's not multiple choice, which at least I could win. But ACRE really is a very exciting initiative. Just last week, the AI Hub announced 4 selected vendors, Cambridge Computer, Dell Technologies, NVIDIA, and VAST, to manage the ACRE cluster and bolster the state's applied AI effort. And this investment, which includes an equal match from the MGHPCC's 6 academic partners, will make GPUs and compute infrastructure more accessible to universities, startups, businesses, and the entire community. And really does support the AI research that is done at institutions like Lahey Hospital. In addition to ACRE, there are also a couple of other MAAI Hub programs. The Data Commons, it's a flagship initiative of the MAAI Hub. It works to create trusted pipelines of anonymized data and supports responsible research, development, and deployment of AI Hub models. And this is also something that the Lahey Hospital Innovation is dedicated to. They also launched the High School Student Summer Career Academy in AI and Future Ready. And again, this reflects a commitment to starting AI education very early on, from high school all the way, all the way through adult learning. And again, on the Lahey front, this is a team that is very, very committed to supporting that, as you heard from the panelists earlier. So I'm very proud to announce the Lahey Innovation Hub is the newest member of the Massachusetts eHealth Institute, or MIHI's Digital Health Sandbox Network. MIHI is another one of MasTech's 7 divisions, and it leads the innovation effort in the digital health space. The MIHI director, Keely Benson, who I believe is here today, she has a team, and they very much serve to be both an ecosystem connector and a catalyst, helping early stage startups refine their products. They're launching public-private partnerships and convening innovators in a diverse industry. And one of the key ways that MIHI does this is through the Digital Sandbox program. It's really great to have Lahey added to the Digital Sandbox network. So now the program has scaled to be 11 cutting-edge research and development centers across the state. And all of these centers are working to advance the digital health sector. There's actually been recently some great press as well about the Digital Sandbox. It's one of only 2 programs nationwide in the Rural Health Transformation Program, and has been called out in several publications for being on the leading edge. So I look forward to seeing how this new partnership between Lahey and MIHI will continue to power healthcare innovation. And as always, very eager to see all of the programming that Sabrina Mansour at the AI Hub will be putting in place over the coming year. Thank you so much.
All right, thanks, Undersecretary. Where are we going tomorrow? She and I were at RE together yesterday, so let's give her another round of applause. With that, I'd like to invite Carla and Sabrina to the stage, my fellow panelists, and we'll kick it off. All right, good afternoon, everyone. First, let me extend Rachel's condolences. She was not feeling well this morning and is not able to join us. So it'll be the 3 of us. I'm going to change up the script like I always do, so we're going to have some fun. So I'm going to say a few things, and I'll introduce myself and say a few things. I'll ask you to introduce yourselves, and I'll prompt you probably in my introduction to comment on a few things. And then I'm going straight to the audience for your questions, because I go to so many panels and never have the chance to ask that question I want to ask. So I do this a lot, and it's never failed, so don't let me be embarrassed and have it failed here. Of course, I have questions I can ask if I need to. So part of my job here, I think, is to be maybe a bit provocative as we think about AI and healthcare, AI in general, and AI in healthcare, and AI in the state of Massachusetts. First and foremost, what I would like to say, I think, is we heard a lot about AI this morning, but if I read the through line of what that was all about, it was about large language models. And that's just scratching the surface of what AI is and able to do, which is what we often don't do as a group of people, is define what AI is. I think also, interestingly, we have agentic AI, AI with agency, that's really interesting to think about. You know, Susan said, introduced the concept of meeting the patient at the door through AI interventions. Well, then maybe I'm met at the door, the doctor says you need a CAT scan, the CAT scan is done, it's read by AI, scheduled whatever procedure I need without the intervention of the doctor at that point, and then the doctor and the data are presented to the patient. I think we need to really think about what that looks like. I also think regulation is something that's interesting, and our first speaker mentioned governance. I am personally a proponent of regulating AI outside of the context of the way we regulate other things. And we think a lot about that, so there's a couple of things there. So Sabrina and Carla, I'm going to ask you to introduce yourselves. Sabrina, I want you to lean into how you think about AI and the state strategy on AI, because as I understand it, it's about being applied AI. And then Carla, I'll ask you to introduce yourselves and And then I'll ask you to talk about how our quasi-state agencies like MLSC and MTC work together to really take that applied AI into the domains like life sciences and health sciences in which we work.
All right, so I'll kick off with my introduction to Sabrina Mansfield. As the director of the Massachusetts AI, I was actually fortunate to come into the role with a very clear mandate coming out of the recommendations from a strategic task force to the governor. Those being around accelerating innovation, and to that end, really being able to help be a connective tissue across the ecosystem. We know in AI, collaboration, as the prior panel spoke to multiple times, right, is really key. This is moving so quickly that no one entity can do this on their own, and we have to connect the various parts of the ecosystem to move forward. The second being around the talent and workforce. So education, K through 12, all the way up through mid-career talent and making sure they're upskilled. And we have programs that I can speak to as we continue the discussion here around that. The third is around equitable access to data. So a lot of value is in the data sets, and people are realizing that and starting to be more and more close-held with that. And so the state is leaning in and working with all of these ecosystem players to help make sure that we do continue to have that open data sets and are able to support that as well with compute infrastructure that we are at the AI Hub looking to coordinate across the state. All of that with the lens of responsible AI development in Massachusetts has a great opportunity, as they already are in practice, leading with the responsible AI development.
And I'm just gonna say one thing that you sparked me to remember whenever I talk about AI, because it's my favorite phrase. Data is king. We can't do anything with AI without data, but garbage in, garbage out.
Hi everyone, I am Carla Reinhold. I am a biomedical engineer by training who came to Boston to do a postdoc at Children's. I later went on to manage an internal fund there where we were investing in technologies that we thought we could either spin out or license. And that really sort of combination of both working on the research side and thinking about the patient and the translational technologies, I think really helped set me up for the career that I have at the Mass Life Sciences Center. So I've been here for just over 7.5 years. My team manages a portfolio of between $25 and $30 million a year that we deploy at the universities and the academic medical centers around the state. We've been funding, sort of the basis for some of this AI stuff. We were some of the original founders of the Mass Green High Performance Computing Cluster. We gave them a $4.5 million grant back in 2013. So we've been doing this for a long time in various ways. And to your point, Jared, like that foundational data, right? So we are, paying for the head and neck MRIs at the Brigham. We are paying for mass specs. We are paying for, just all sorts of spatial transcriptomics and all kinds of new and up and coming technologies to build that data set that you can then use to, develop new algorithms, but also just deploy things against. And so that's sort of where our, where we sit in this.
And how do you, as quasi-states, collaborate in these spaces in particular? Because what I would argue, and I'm going to argue right now that you can tell me, hopefully you tell me I'm wrong, is that the state of Massachusetts has strength in healthcare, has strength in life sciences. We have strength in AI and robotics. But what I see as a citizen, not as Jared the professional, is very siloed vertical lanes, and how are you crossing those lanes together to drive the economy and the innovation?
Yeah, so AI is a cross-cutting technology, no question, right? I don't think there's any sector that it's not all touching today. And so there's a lot of strength in having domain expertise that are living and breathing in the ecosystem, right? And know all the players and know where grant funding will support and booster the economy, right? And so, in my role within looking at AI, being able to collaborate and work with the quasis, either outside of Mass Tech, and we've done a lot with life sciences, as well as within Mass Tech, which has a number of hubs in different sectors.
Yeah, I would say, in addition to our collaborations and, just relationships that we've built with the other quasis, we've also structured a lot of our grant programs to require collaboration. So whether it's across academics or requiring academics to partner with industry, right? Because we really want to know that there is a market for the science that we're helping to fund and that technology that we're helping to build. So that I think is extremely important.
And I'd be remiss to not mention also the business front door that sits at the economic development level. And that's for businesses to come and understand what are the grant opportunities across all of these quasis, right? And so it just helps streamline and funnel in the right direction.
Fantastic. Are there questions in the audience? You got to walk to the microphone, so I'm going to ask them one question while hopefully somebody's walk forward. So the title here of our panel is Building the AI-Ready Care Community. And for me, when I think about community, in the early, I'm an academic, clearly. In the early part of my career, I thought about government, I thought about academia, and I thought about industry in that collaborative community. I think fundamental to what has evolved in my own thinking is engaging, for me in my work that I do in workforce development in particular, is engaging community and bringing community into the conversation. So in the context of healthcare, clearly we want to bring the patient into that conversation. I mean, I get up every morning for two reasons, to help students, but fundamentally for the other things I do in Burlington itself is for patients. So how do we think about building this AI-ready care community with the patient in the center and in the front, but not only just being present, engaging them actually in the conversation of building that community and hearing them?
So this is really important, I think, for one of our brand new initiatives that we've been working on for the past year. So we are trying to build out a statewide biobank. And so we're looking to collect longitudinal samples, net new collection, so that everything can then be collected in the same way. And we're doing it in two specific diseases. So we're looking at Alzheimer's disease and colorectal cancer. And we arrived at that by doing a survey of the ecosystem, right? So we asked, which samples, which data sets are you having trouble accessing that you think are right for innovation? And so then, we identified these two things, and then we have gone out on a fact-finding mission, right? Engaging all of the hospitals across the state. We have a really great partner here in Lahey. Dr. Kimberly Christ has been really instrumental in working with us as we think about what does consent look like? What does the governance, the IRB, how do we bring all of these hospitals that have such different cultures together and bring them together under this new mission to ultimately help the patient, right? How do we help diagnose them faster? How do we help bring therapeutics to them faster? And I think underlying that gets back to our original thing of the data itself, right? It has to be diverse, but from multiple perspectives, right? Socioeconomic, geographic, but also the state they are within their disease progression, right? So if we're only looking at the sickest of the sick, then we're gonna not be able to detect some things early enough. So really just kind of bringing the patients along, making sure that we are speaking to the patient advocacy groups and others in those areas. And I will get into the question.
Yeah, well, look, Sabrina, she has a comment, but also I'll double down and congratulate NLSC on that biobank, in particular crowdsourcing what the best diseases to look at. I filled out the survey, it was really extensive, it was awesome. And also I would emphasize that when you think about healthcare, I was an ALS researcher for a long time. Really easy to get ALS samples, really hard to get normal control samples.
And I think the question you pose is a very high level broad question, right? And I think there's a lot of ways that you attack that. And I'll speak to the grant programming that we want, right? When we evaluate opportunities to do that, we're looking for the bidding entities to be speaking to their approaches, right? And where there's strength in that, where we see that they're considered more favorable for the funding. Of course, I think there's also again collaboration, Lahey sandbox, right? Mm-hmm. When you're having shared learnings across, and you're able to bring those to your institution, that's another way you are approaching the problem.
And how do you? We're going to come to it, I promise. How do you think about sandboxes though, and access to what I might call lovingly on purpose biohackers? Right, it's not only us trained researchers, if I can call myself that still, I guess, and others, but like Microsoft has started in the garage with the democratization of data sets and access to those data sets. I think we can expand the network, but how do you make that? How do you think about that as a concept? And I'm thinking that I just thought this question right now because I've never thought about this. So good luck.
Oh, okay. I'll pick on the word hackers that I use, right? I think that's a really fantastic approach to tackling, new innovative development, and to be able to bring, the energy together with folks who are working towards a common problem, and again, share learnings across them. We recently brought on the team here one of the co-founders of the Sunday Foundation, which is a group of MIT and Harvard hackers who get together on the weekends and hack our common purpose towards a common goal. Every week's a different theme, and they themselves are saying, there's no one expert even within that community, and they're constantly doing it, right? It's across that community to stay on top of what are the best tools to use for a certain problem.
Go ahead now.
This was mostly in support of, moderator, but
I appreciate that. Where are the other people? Where are the other questions?
So I just wanted to build on this notion of the patient-centered care, which, we're talking about our ability as quote-unquote experts to provide opportunities and direct the way that we manage healthcare. But to put the patient truly at the center of their healthcare, one thing I reflect about is, for instance, I'm wearing an Apple Watch and I have an Apple iPhone, and it's recording data on me all the time, 24/7. I have a primary care appointment once a year in around February, which usually means about this time of the year I'm starting to worry about my lab tests, because I know that I have to have a lab draw at some point in March, and I'll defer that as long as I can and adjust my diet so that I can get enough good sort of results.
You're making me feel good about myself, by the way.
So this is my paradigm. But what if there was this agency around me, informed by AI, which understood what my family history was, what my current state of being is, and could actually guide me when I'm at the grocery store, in a restaurant? I could scan the menu, it would advise me what not to order. And that's elements of health, so real health prevention. And then to just, to dovetail onto that piece around hospital at home, that we should not be dependent on our brick and mortar facilities to deliver health, but rather empower people to make the right choices in their day-to-day lives, but also to be able to confer some of the care into their home environments, especially for an aging population. That's very powerful.
Yeah, I think that's a great point. I'm going to go to you all in a second, because I think, fundamentally, it also talks. So I think we do better. I still don't think we do great at patients owning their data. Like, I get my data in my chart and I look at it when I get a result, and that's it. Like, and then I look again and I see the trend maybe. But if you ask me what vaccines I've had since I was a kid, I have no clue. I mean, I hope I have them all. I assume I do, but I have no. Those records are paper and destroyed, probably, right? So we have a moment in time to do those things right, to build that. And I'm going to let you answer, but maybe Sabrina, you know the story of Carolyn Kirk's Apple Watch and her heart that she shared at the Carolyn Kirk Taylor event that we did a couple of weeks ago, so that you could comment on also.
Well, there's something really beautiful about what you said, which is what if, right? And I think that's what's so exciting about the time we're in right now, because everything you just described is entirely possible through collaborations and through, we're lucky in Massachusetts to have the government leading in here to support all of these ecosystems coming together. So I think that's very exciting.
Yeah, no, I mean, it's a really great example that you bring up, and I would say, we try and think about different stages, right? Breaking that problem down into different parts. So the Apple Watch, can you predict heart failure, right? The sickest of the sick, but you're talking about your everyday, but also you're sort of woven the concept of food as health, right? Which is also really important, like the diet, but then personalizing that across different cultures, right? And so we have a variety of projects that sort of touch on a lot of these different things. But you're right, there's not an overarching plan that's gonna just take your data and know that you have an appointment coming and that you're worried about this and you're predisposed to that and sort of tie together it for you. But I think that, by having experts in each of these sort of individual buckets, we might get there sooner.
Sounds like a great opportunity for collaboration if anybody wants to talk after. The other thing that I think I should mention about AI, that every time I'm on a panel I get yelled at afterwards for not mentioning, is the environmental impacts that the compute power is going to have in the chip development, and how that also could negatively affect our health. And also in the long term, that those technologies are going to become obsolete really quickly, and we're going to have to replenish them. So in the context of AI, I think it's important, especially related to health, that we always keep those things in our minds also. And I do think it's an opportunity for new research collaborations and opportunities to innovate in that space, especially as the state also focuses on quantum and there's opportunities there. Go ahead.
Thanks. First of all, I just want to thank Lahey for bringing together people like yourselves to help us explore this critical issue and how it's going to help us with healthcare. That said, I have been following the Digital Sandbox program for a few years as an aspirational AI type of guy. And I would have to say it still seems not very transparent about how an entrepreneur can access the data to begin playing in the sandbox. It does seem, at least right now, it seems to be very oriented toward researchers. And we need researchers, okay? I will, though, say, being a VP of product development for 22 years at Medtronic, we need to turn research into development. And that comes from entrepreneurs. And the key that will stifle innovation is lack of access to de-identified medical data. And there is already a war that has been waged for a long time between institutions and corporates, which I was a part of, to not open that data. And with taxpayer-funded money to create these sandboxes. Sabrina, I'd like to hear your vision of how we're going to develop de-identified data for entrepreneurs within Massachusetts and the US to come and play in your sandbox. And Carla, could you follow up with what Mass Life Sciences is awesome with its grants? Can you describe how your grants will help not researchers, but entrepreneurs take advantage of this opportunity?
Just one cranky comment before you both answer. Researchers can also be entrepreneurs.
They are, but I work with them too. And they usually need a little help.
Depends on who you're working with, yes. Go ahead, Sabrina.
It's a wonderful question, right? So the vision for the Massachusetts AI Hub Data Commons Collaborative is to have a platform that has open data sets. When it comes to the de-identified data from hospitals, for example, right, federated learning across, we're going to have to think about the incentives, right, and aligning those to motivate those types of collaborations or openness. And ideas in mind now, right, around competitions to solve for a certain piece and making some of that hospital data available to do that. And I think there's incentive from the hospitals to see the value of the data then come in reality versus this perceived value that it has. And then also it gives them direct line of sight into the startups that are being able to develop solutions that would benefit them, right? So I think that's a shared incentive. Also looking for this data commons to sit on top of the compute investment that the state has made. And that's another incentive, right, where everybody's really competing for access to compute right now. And that's why it's designed in that way.
Great. And I would say, it's very important to the MLC that we know that we are taxpayer funded and that we are here to serve the entire ecosystem of the Commonwealth. And so the Bits to Bytes program, for instance, is our program which has been funding AI and ML projects since 2018 when I joined the center. And as a requirement of that grant, it requires researchers to partner with industry of all sizes, right? As we've had as small as 1 FTE companies all the way up through the very largest of the large. And what's actually required is at the end of their project, they have to make that data publicly available. They have to publicly post it. And then all of those data sets are actually available on our website. We have links to all of them. It's called our data repository if you're looking for it. I'll also give a shout out to our RED database, our research equipment database, where you can go generate your own data sets. These are all in core facilities where you can walk in and out with your IP intact. And so I would say, we've been funding data sets of all kinds. So some of it is patient-derived. So the MIMIC database, which is one of Beth Israel's sort of long-standing databases of cardiology data. we funded that. We've also funded, chemistry data sets, right? As we think about molecules or, just screening libraries. We have cell painting data sets out of the Broad. So there's a variety of different kinds of data. Some of it imaging, some of it cells, some of it, mass spec, microbiome. And so hopefully, as we continue to build out these resources, there will be things that are of use to you.
I'll also make a comment and then a comment that you can respond to. I think one of the things that's really interesting as we get into the AI age and we talk about data is the concept in changing the mindset of everyone, individuals in particular, around data and data ownership and what we can do with data, right? That's your question was suggesting. And I'm not a doctor, at least not a medical doctor. As a life scientist, right, in that context, I think about, is there an opportunity for the government, federal government, or state government to fund core lab infrastructure, what they call programmable cloud labs, where you can collect data, then generate data sets based on X, Y, and Z parameters that then you make available to the world, right? Because we have too much lab space in Massachusetts and we can't keep creating the same infrastructure. So really thinking about that is interesting. The other thing I think I'd love both of you to comment on is quasi-states in particular. I'm a Massachusetts resident, I'm an voter and taxpayer and all those things. I'm all about the success of the state, and I'm thankful in this moment in time that I live in Massachusetts, so these innovations and opportunities can be driven through state engagement that it might not otherwise have been possible. I think that's super important. That said, I do think that we don't want to become so insular as a state that we ignore what else is happening around us in the country. But even beyond that, and I do understand the geopolitical landscape in which we exist, the United States is really bad going to other countries to learn from their innovations. I'm not thinking about healthcare in particular at the moment. I'm thinking about shipbuilding. Finland and Korea have the most advanced shipbuilding capacities in the world, and we are too arrogant to go ask them for help, generally speaking. So how do we do what's best for the state, but not at the expense of what's best for the patient, which means a more international approach?
Yeah, I can speak for the Massachusetts AI Hub and the construct of it, right? We very much looked outside of ourselves. I think Europe has been taking this approach in many countries in Europe for quite some time. And so there's lessons learned that were included in the formation of this hub and in the pillars that we have. And another example is Australia. Australia has a phenomenal data commons that we're looking to model ourselves after. So I do think there is there is very much an awareness of what is out there and look at what has been working well.
Yeah, and I would say the other piece too is, we spend a lot of time talking to delegations from foreign countries. We also have programs for underrepresented entrepreneurs to really help them excel here. And one of the categories of that is actually refugee, immigrant, and migrant. And so, we are encouraging entrepreneurs to come here to Massachusetts to build and grow here. And as part of that, they're bringing their learnings from other places and, the culture and education that comes with it.
You sparked that question, Clifford, by your question, but it also reminded me of our visit yesterday and you talking about the international opportunities. So I think it's just important for people to hear. Are there other questions in the audience that anybody would like? We have 4 minutes in 6 seconds, counting down. I can see the clock. I sat this way though, so I wouldn't have to look at it.
Sorry for being me again, but you said something that really sparked a question for me, which is learning from other places. I get a little concerned that there's a lot of pride messages around education and technology, and I grew up outside of Massachusetts, and sometimes that turns into a certain degree of smugness and simplicity, and I see other states in regards to AI initiatives, and particularly library education, being a little more creative and moving forward. So what can we do in terms for Massachusetts to learn not only other countries, but other states in terms of what they're doing? Because I am concerned that we might fall behind. And I speak as a son of an IBM employee who remembered how they were at the top, and they were always going to be at the top until they weren't.
Yes.
So I'm concerned about that. Glad to hear about that.
So when I'll take that one ish. So fundamentally, I share similar concerns, and what I would say to you is what I say to anyone anywhere, people who know me here know I say these things a lot. We can look at that I look at that with two lenses. There's the AI piece, and we need to be training on AI, and then there's a general education piece and what the future of workforce and learning looks like throughout career. And I think technology-wise, the state's really good at driving those innovations. The education sector, which I work in also, probably get myself fired one day, it's fine. And then if anybody wants to hire me, just come see me. Fundamentally though, the state of Massachusetts is lagging very far behind in the educational innovation that we need to remain competitive. And I won't get into my thoughts on that, but we could talk about that, and probably should talk about that anytime, because I have lots of thoughts.
If I can just take a minute to react also, I think I wanted to jump in on the earlier panel too around education. I think we're in a revolution when it comes to education right now. Because the students have to learn so much more, right? There's the domain expertise, but also, applied AI, machine learning, right? And that's why the state is really leaning in and making sure they have that fundamental knowledge available to them. And we've already been able to roll out a curriculum that's a semester long within high schools, where they're learning machine learning and they're understanding about preparing data and deploying models and how you have to continue to tune the models after that, right? So I think education is becoming more efficient because of AI, but there's a lot more to learn at the same time.
Yeah, and I'll double down and re-emphasize Susan's remarks at the beginning with the thinking about apprenticeships that are not in the traditional skill-based fields like electricians and plumbing. That's it, plumbers, which are important, but also beyond that is important. The other thing that I'll say is, and I'll layer some language on top of Sabrina's comments that I think are really important. We need to move to a skill-based educational model linked to competencies that's not only theoretical. And that's what you described as a skill-based curricula. But we need to really think about that more holistically across the education spectrum, K to birth to earth, as I say. But then also we need to use AI and think about the structures to put those things together, because just throwing money at it is going to create an ecosystem of 1,000 flowers blooming with no coordination. Go ahead. Your last question.
All right.
Last word.
Okay. Rachel Kaiser with Project Elevation Partners, founder, helping organizations implement projects, especially right now with AI integration within their health systems. Okay, my question is, I think we've all seen right now how things are going with AI. A lot of layoffs, people being told you're being laid off because of AI. So how or what are you doing with creating an AI-ready community or care community, helping to explain that so that people are not afraid of AI, and instead at least we statewide showing the upside of integrating or using AI and also being AI ready, because otherwise people are like, I'm going to be fired anyway. So what are some ways that you're going above and beyond to overcome that?
I'm going to go to you first, Carla, because I want you to go back and tell Kirk that I quoted him. Kirk Taylor, the CEO of MLSC, often says the people who are at the highest risk of losing their jobs are the people who don't know how to use AI. So that's one thing. The other thing I would just comment on before I pass over to you both is this is not new. We had the internet evolution, we had the industrialization of the economy hundreds of years ago. So it's not a new challenge. We always adapt, and how are we going to adapt is a question that you're being asked.
Yeah, I would say from the MLC's perspective, we have a data science internship program. So we try and pair students, so whether that's undergrads, masters, PhD, or postdocs, with startups here in Massachusetts. So companies less than 100 headcount here. And it's a multi-month program, and really trying to help train students for the workforce, for the life science workforce in particular. When I had launched the Bits to Bytes program, we had done some research, and we could really see that a lot of the talent was leaving for the tech sector or the financial sector. And so we're really focused on how do we keep that talent here in Massachusetts, because as we know, there's many universities here with top-notch talent, but how do we engage them and get them motivated by the potential to help people and that sort of internal driving factor to sort of bring them into the life science space. So that's sort of what we're doing is through the various grant programs and internship programs to try and train talent.
Sabrina, last word.
Sure. So looking at this holistically across sectors, right? We think about making available opportunities for upskilling in many different formats, right? Whether that's digital certificates that have job boards on the back end that recognize those certificates as people are able to get them and they start at different people's journeys and comfortableness level with AI, as well as grant programs for in-person training opportunities that might be aligned to sectors and where we see growing needs within Massachusetts, right? We're trying to skate to where the puck's going in terms of those needs. We're also standing up a job board just to make clear within the Massachusetts AI Hub how many opportunities there are in the state, at any given moment in AI and machine learning, so that we can turn people to them and say, these are the skills you need to be upskilling yourselves to achieve and be able to work towards these roles. So thinking about all the different levels and working with companies right now as well as they upskill their own talent, right? They would absolutely prefer to upskill their talent and retain than to lay off. I think a lot of the headlines we see, you can't necessarily say 100% that these companies are laying off their folks because of AI. They might be taking advantage of the moment, right, for the rhetoric. So I think that, there's definitely going to be change. I'm not going to say there's not going to be change and transformation as this, adoption continues. But I personally believe in everything that I'm saying that there's going to be more opportunity than less.
All right, I'd like to thank Carla and Sabrina for sharing the stage, and Lahey and Middlesex for the opportunity to have this conversation.
Amazing, thank you. This will be literature by teams, that's going to be a good theme. And the first one is patience. Thank you so much for waiting. I know we're running a little bit over time. Just a huge thank you to you being here today. And again, keep your hands together for some incredible speakers. So I mentioned the P format. And really I think that what I want you to take away from today, I think there's three important P's. We started with people. And again, that's patience and the people in the room today. The fact that we're thinking about talent, and that's what excited me at the beginning of Northeastern. We're thinking about how do we develop the right skills, the right pathways to work together and to have the people collaborating. And that collaboration is so key. That's the second key, partnerships. That second partnership with the sandbox is so important. So Cliff, we recognize that challenge around the de-identified data. We have an idea about how to address that. So thank you. That wasn't a planted question, but I think again, it's something we think deeply about. Indeed, we had a workshop this morning about that very topic. And then lastly, of course, it's how do we prosper together? It's really the fundamental thing for us. And when I think about prospering together, really it's about the process. We have to standardize. We have to start somewhere. It's never going to be perfect, but again, the ability for us to bring people together like today. And then excitingly in the new year, for us to create a process which standardizes how do we collaborate. So part of that is for us to be able to prioritize what are the problems at Lahey that we want to solve first. Because we don't tell you, it's guesswork. And I think there's a lot of inefficiency. And so for us in the next new year, we're going to be launching our new digital portal with an innovation challenge. We're going to be saying to you, these are the things that we're looking to solve. So that creates efficiency in itself. And then secondly to that, I think this whole theme around care is so important. That's why the values we showed at the beginning of We Care are fundamental to the hospital, to the system, and to our everyday lives. And I'm constantly amazed by whether it's Dr. Rathman or Dr. Martin Bruce, our speakers today. I feel like there must be about 10 of you. You must have doppelgangers because you're up at all hours, you're messaging at all hours, and they're incredible and they truly care. And that's why to us we thought about a hackathon model. It's called a care-a-thon model because we do truly care. We want to bring people together and we want to actually implement. We want to be successful in that implementation. And we want to be able to have awards. And that's why I'm so grateful again to the support of Ruben Gruber, as you mentioned at the beginning, because he is that person with that vision. And that's so important that you have that support to be able to translate some of these ideas. And of course, lastly, looking ahead for a year from now, we'd love to bring you all back together and discuss success and to learn from one another. We've heard that so many times today. This will not be successful unless we go on that journey together. So, great things happen in threes. This is your third QR code. I promise it's your last one. But please do share your feedback today. We want to understand what are the things we missed today. What can we do better? How can we collaborate? What are the ideas? What are the things we're missing? And so I think that's so important. I do have so many thank yous to say, so please do bear with me so I can get through these. But again, I want to say a huge thank you to our ecosystem partners who presented today and all our speakers. Just a huge thank you. I want to say thank you to Middlesex 3 and all the fantastic 3 and all the Hub team, to Kim, to Liana, to Katie, to all of you who've been involved in making this event possible. And lastly, I just want to say a huge thank you to you, again, for taking your time to be here today. I know it's, the holiday season is on the doorstep, and so again, I just really appreciate you being part of this process for us. So I wish you a prosperous and peaceful holiday season. I wish you a transformative 2026, and I look forward to seeing you again soon. Thank you.